Um, okay, so hello. Sorry for the technical difficulties. My name is Liz Weiner. We submitted a poster, as you can see, and I'm a senior instructional designer at Samuel Merritt University in Oakland, California, with a focus on AI for teaching and learning and faculty development around AI. And my co-author is Dr. Rhea Kimpo. She is a neuroscientist at Samuel Merritt University, an associate professor, and also the acting co-chair of our basic sciences department. She's not able to present with me today, although she was here a little bit earlier listening to all the great talks. So we are talking about allied health students' perceptions and use of GenAI. So obviously our project is similar to Dr. Jadav's, but with our particular student population. So let me tell you a little bit about who we are. So Samuel Merritt University is a small health sciences university. We're in Northern California. We do have 4 campuses. So we are in the Bay Area of Oakland and San Mateo, as well as a campus in Sacramento and in Fresno. And within our structure, we have 3 colleges. So we have a very large College of Nursing. We have a growing College of Health Sciences and also a College of Podiatric Medicine. So as we've all been saying, we know that AI is transforming higher ed. And that's also very much true for health sciences and healthcare, right? So that is happening in all kinds of ways around imaging, diagnostic support, documentation, just to name a very few of many, many ways that AI is growing in healthcare. So in a way, we have kind of a double whammy with AI at our university, because we want to teach our students to be responsible and ethical users of AI as students, but also as future clinicians. So we wanted to, let me just focus in a little bit. Thank you. So we wanted to learn how to support our students to become responsible and ethical users of AI in both of those contexts. And so to start that, we wanted to assess where they were starting from, or where they were at this time, and what they felt that they needed in order to be successful. And so we wanted to learn about GenAI use, perceived ethical boundaries, exposure to faculty guidance, and support needs. And spoiler alert, I think we found, just as Dr. Jadav did, that students who get guidance are better users of AI than students who don't get guidance from their faculty. But let me tell you a little bit more about what else we learned. So we wanted to know about their ethical boundaries and their support needs. And then we wanted to see if different groups, if nurses were approaching this differently than podiatry students, et cetera. So in the spring of 2025, we conducted a survey. It was anonymous, 10-15-minute survey, pretty short. And we used a couple of existing student AI surveys. So the Digital Education Council did a global AI survey in 24, and UC Davis had one as well that we modeled some of our questions on that. And we partnered with Student Affairs at our university to really help get the word out about the survey. They were wonderful. They sent emails on our behalf. They helped us post flyers with QR codes around the university, and we kept the survey open for quite a while. So we pushed very, very hard. We promoted it a lot, and we were able to get about 25% of our students to respond to the survey, which, if you do surveys, that's pretty good. So we were very happy with that. And so we learned a lot. So we learned at the time, so this was like winter, spring of this year. At the time, we learned that about 61% were using it daily or weekly. And honestly, I'm sure it's 90%, 90 5%, as Dr. Slack was pointing out. We're really, the usage is very, very high. And I think this was a little bit underreported, and also some time has passed. We also learned that, sorry, just one second. We learned the most used tools were ChatGPT and Grammarly, but we had a couple of good write-in candidates of Google Notebook LM, and Perplexity also came up a lot as tools that folks were starting to use. And they were using it, what they reported to us is really, I mean, we know we talk about academic integrity and cheating all the time, but we heard from them was that they really liked to use it for clarifying difficult topics, for extending class learning, and for writing support. And we have a wide range of ages in our program, because we go from pre-licensure nursing students all the way through doctoral degrees in, podiatric medicine and physical therapy, et cetera. So we have a huge range, and we were surprised to find a little bit that frequency of use did not differ by age, by the year of the program, how many years they've been in their program, or by which program they were in. But we did learn that frequent users had more confidence in their abilities, which is this. Sorry, let me try to show this a little better. So I guess it's here. It's a little hard to read, I apologize. But those who used AI more were more confident in their abilities to use the tools, about their knowledge and skills, and their preparedness to use it in the future. With, in particular, students under 40 reported higher confidence in using GenAI. So they weren't necessarily using it more, but they felt that they were using it better. And we also learned that overall, however, our students were not really feeling very confident. We saw only about 60% thought that they had sufficient knowledge and skills, and only about half felt that they were ready to use AI in their future careers. We also learned that they are very much looking for guidance from their faculty. So more than 70% rated university instruction on ethical use of AI as extremely or very important. And I think about 60% said, yes, we want you to teach us GenAI literacy. We want our faculty to teach GenAI literacy. And then more than more than 90% said it's at least somewhat important that we teach AI literacy, ethical use, and AI for their future careers. And again, the very gratifying thing that we found was that when students had guidance from their instructors about how to use AI, what was acceptable, then that really did influence their perceptions of what kinds of activities were ethical and what kinds of activities were not. And so overall, as an instructional designer, this was great news, right? If we teach them about it, they learn, essentially. But so we found, the widespread use and the strong demand for guidance and support really supports integrating AI into the curriculum. And so as an instructional designer, this information has been important to us in terms of what kind of faculty development we create. We've worked on student AI literacy modules. We've brought in lots of speakers on different topics. We've had a lot of faculty forums where faculty teach each other about how they're using it in their courses. And then I've also, as an instructional designer, been able to use this data to advocate for resources from our administration to help educate our students, because we can show that they want it and that it actually helps. And that is my presentation in a nutshell. I don't know if anybody has any questions.
I have a quick question, Liz.
Mhm.
I may probably, you must have mentioned and I missed it. Was it this study conducted over a certain range? And when was that? I'm curious, in the age of AI.
Yes, it was this spring. So we started in really probably end of fall semester. So in December, I think in December, and then we really kept it open for a long time to get a lot of responses. So it was maybe like late December through March, I think,
Okay.
of this past year.
Okay. Thank you. Just gives me a sense of where AI was at that time and the ease of use.
Right. And I think, I think we would get some different data now if if we ask them, because of course, everything just is growing at such an incredible rate.
That is true. Thank you. Great presentation.